Okay, welcome back. It's Dr. Lindner. We are still on the heart, and it's important that we talk about the heart muscle. Now, remember what I said in a previous video. We know that the left side of the heart is much thicker and bigger than the right-hand side. We said that the muscle in the atrium, those are called pectinate muscles. Pectinate means comb. It's like taking a comb like this, and if you were to streak the teeth of the comb in the muscles, you'd get that type of appearance. Whereas in the ventricles, they're called trabecula carneae. It kind of gives that spaghetti-like appearance, trabecula carneae. Now, we can see the trabecula carneae in the ventricles. We can see pectinate muscles in the atria. Now, another important structure off the trabecula carneae are these hills. The hills are called papillary muscles. Now, there is an extension right here. These are papillary muscles, these hills. Those are papillary muscles. Now, there's an extension from the papillary muscles to the valves. Now, this on the right-hand side was the tricuspid valve, and on the left, that's the bicuspid valve, which is also equal to the mitral valve. The connection between the papillary muscles and these valves are called chordae tendineae. Chordae tendineae. They are tendinous cords. Chordae tendineae. And the reason why we have this connection is, remember, the ventricles are contracting from inferior to superior. And as blood is pushing up, we want these valves to close nicely. We don't want them to overclose and prolapse due to the increased pressure. So we need to have these cords providing additional tension or resistance to prevent overclosure, because we don't want blood to leach back, slipping through the valves back into the atrium, because then the blood leaks back into the lungs, and that would be very, very bad. Notice the muscular wall here has a name, and it's called the interventricular septum. That's the muscular wall here. So the mitral valve, also known as the bicuspid valve, and the tricuspid valve are strongly supported by these papillary muscles and the chordae tendineae. The two structures prevent inversion of the mitral and tricuspid valve when the ventricles contract. So what it looks like here, we can see the papillary muscles. Here are the chordae tendineae, and then here are the bicuspid valves. And you can see that the chordae tendineae are slack here, right, nice and loose, but here there's more tension and they're taut. And that's because the blood is pumped upward, closing the valve, and the tension just needs to be perfect. Otherwise, blood will squeeze through that and seep back into that chamber, which is the atria. And we don't want that to happen. Sometimes we'll call it a prolapse, like a mitral valve prolapse when that happens. Okay, so the endocardium also consists of a single layer of endothelial cells, and these are prone to damage. Endothelial cells are really squamous cells. Remember those flat, irregular shaped cells? They're very prone to injury. Okay, when we come back, we'll talk about the closure of these valves.